Vision Tech Electronics was established during the year 2000 in Ahmedabad, Gujarat, India, and attained registered trademark under Trademark Registry, Class 9 and Class 11, Government of India, entitled Vision Tech. Vision Tech Electronics is an ISO 9001:2015 CE certified, RoHS certified company. Our AC/DC switch gears are approved by BIS and is registered as micro small scale industry. We have wide experience, more than 20 years, in highly specialized lighting, UV related applications and apparatus. Are you victimized of skin related chronic disorder like white patches, vitiligo, psoriasis and other similar skin conditions? There is a unique and innovative solution of your worries. Vision Tech Electronics presents narrowband UVB phototherapy device, 311 nanometer. More than 400 clinical trials, research, evidences have shown that precisely controlled irradiation of 311 nanometer energy helps in treatment of vitiligo, psoriasis and other similar skin related conditions, and has treated thousands of patients with excellent results and without any significant side effects. Before going through the detailed explanation of narrowband UVB phototherapy device, we need to know brief details of the anatomy of skin, probable reasons of ailments, along with diagnosis of the vitiligo and other skin conditions. What is vitiligo? Skin condition in which white patches are visible on any part of body. This is non-contagious disease and can occur any gender, race and age. Though this condition is not painful but highly impact the quality life, usually sufferers are severely psychologically affected and face the social stigma. Estimated worldwide population of vitiligo is 1% and estimated population of vitiligo patients in India is 2.5%. Largely, vitiligo has been categorized in two groups. First is non-segmental vitiligo and second is segmental vitiligo. In non-segmental vitiligo, white patches are seen anywhere on the body part and further can be categorized into three types. First, universal vitiligo. White patches are seen nearly all the skin surfaces. Second, generalized vitiligo. White patches are progressive in nature and can be seen symmetrically on both the sides of the body parts. Third, acrofacial vitiligo. White patches are seen around body openings, such as eyes, nose, ears, face, hands. In segmental vitiligo, white patches are seen on only one part of the body, and further can be categorized into two types. First, focal vitiligo. White patches, one or very few, and in small size, are seen. Second, mucosal vitiligo. White patches are seen in one side of the body part. To understand the probable cause and the mechanism of vitiligo development, we will go through simplified, basic anatomy of outer layer of normal skin. In normal skin, outermost layer is known as epidermis. Pigmented cells over the upper portion of epidermis is known as keratinocytes, and bottom portion is known as stratum basal. Melanocytes are the key cells which produce melanin and define the natural color of our skin. There is higher melanin production in the skin of darker people and lesser melanin production in the skin of fairer people. Just below the epidermis, there are blood veins carry the blood along with white cells and red cells. White cells are also termed as T cells. Though the exact reason of vitiligo is unknown, but is strongly believed that this disease is due to autoimmune disorder. The role of autoimmune system of our body is to protect it from various types of antigens, in other words, bacteria, virus, fungi, and parasites. Autoimmune system creates antibodies and kills the antigens. When autoimmune system is disturbed, may be due to internal biochemical changes in body, hereditary factor, or disturbed DNA pattern, ill environmental effects, and unknown antigens like bacteria, virus, or parasites. In this condition, white cells, in other words, termed as T cells, are disturbed and act differently. Eventually, T cells start to attack and kill a vital cellular structure like melanocytes. When melanocytes are attacked and killed by T cells, melanocyte stops to produce melanin. Due to scarcity of melanin, outer layer of epidermis is depigmented. Eventually, due to this kind of phenomenon, white patches are clearly visible on outermost layer of skin. Now, we will go through one of the worst kind of skin condition which prevails in all over the world, that is psoriasis. What is psoriasis? Psoriasis is a skin condition in which raised, dry, thick and scaly patches are seen over the skin. Psoriasis is non-contagious disease and can occur any gender, race and age. Estimated worldwide population of the patients having psoriasis is 2.5% and all over India is 2.8%. Largely, psoriasis can be categorized into 5 types. First is plaque psoriasis. Estimated population of this type is 80%. Among the total number of the patients with psoriasis prevail all over the world. Symptoms: thick and reddish, silver or white, raised patches of prevalence, elbows, knees, scalps, chest, lower back and can be seen any part of body. Physical effects: very uncomfortable, with dry, itch and painful sensation. Second is gutted psoriasis. Estimated existence 10%. Symptoms: small drop-shaped lesion. Area of prevalence: trunk, limbs and scalp. Physical effects: uncomfortable, dry itching and painful. Third is postural psoriasis. Estimated existence 5%. Symptoms: blisters of non-infectious pus appears on skin. Area of prevalence: palms, hands, soles, fingers, toes. Physical effects: itchy and painful. Fourth is inverse psoriasis. Estimated existence 18 to 20%. Symptoms: smooth, red patches. Area of prevalence: occurs in skin folds like armpits, groins, under breast. Physical effects: worsen by sweats and friction. Fifth is erythrodermic psoriasis. Estimated existence 1 to 2%. Symptoms: severe redness, aggressive, inflammatory, burn intensely, spread quickly, and covers almost whole body. Physical effects: very painful, life-threatening, results in so many health-related complications. Psychological effects of psoriasis: feeling of guilt, shame, embarrassment, poor self-esteem, sexual dysfunction due to continuous self-consciousness regarding disease, suicidal ideation, depression. All those factors lead to bad impact on quality of life and intense social stigma. Now, with a view to understand the pathogenesis of psoriasis skin disorder, we will go through the simplified anatomical explanation of normal skin. Normal life cycle of keratinocyte cells is 28 days. It means it takes to migrate and proliferate from basal stratum to upper portion of epidermis is about 28 days, and then those cells are shredded off after arrival to upper part of epidermis. How psoriasis is triggered. Though the exact cause of psoriasis is not known, but universally believed that this disease is a result of malfunction in autoimmune system. This may arise and aggravate due to biochemical changes in body, hereditary or disturbed DNA pattern, ill environmental effects, external antigens including virus, bacteria, and unknown parasites, side effects of certain medications, stress, bad food habits, excess smoking, consumption of alcohol are also major contributors of autoimmune disorder. Due to disturbed autoimmune system, T cells act very differently. They become overreactive and release the cytokine mediators such as TNF-alpha, IL-7, and they all are inflammatory in nature. All those inflammatory mediators disturb the life cycle of 28 days of keratinocytes. Rather, they set up the life cycle of 6 to 7 days. In this condition, keratinocytes migrate and proliferate at faster rate. It means it takes 6 to 7 days from stratum basal to upper portion of epidermis. Due to this rapid cycle, keratinocytes are spilled over on the surface before dried up of old cells. Eventually, there is formation of dry, thick and raised scaly patches with blisters are seen over the skin. In general diagnosis and treatment of vitiligo, psoriasis and other similar skin conditions, usually patients approach the allopathic, Ayurvedic and homeopathic professional. All the professionals conduct the treatment as per their medications, but usually they follow the one common protocol for the patients to expose themselves under the energy of sun. Main purpose of getting an exposure of sun is to get a radiation of UV energy over the epidermis layer. Now, in later section, we will learn the main role and significance of irradiated UV energy exposure of sun in treatment of vitiligo and psoriasis, respectively. When irradiated solar UV energy exposed over the skin having vitiligo, or more precisely, the pigmented skin, this UV exposure promotes the melanosynthesis and stimulates the melanocytes. Those stimulated melanocytes start to produce melanin. In the same time, it also suppresses and deactivates the aggravated functioning of T cells. Eventually, repigmentation of the cells gets started. In case of psoriasis, when there is successive and subsequent exposure of UV irradiated solar energy over psoriatic skin, T cells comes to steady state. This steady state restricts the stimulation of inflammatory cytokine mediators such as TNF-alpha, IL-7. Eventually, normal life cycle, 28 days of keratinocytes is maintained. Hence, restoration process of normal skin gets started. Apart from both of the sections, we can conclude that in what extent solar UV energy exposure is highly desirable to treat and expedite the recovery process of autoimmune related diseases like vitiligo, psoriasis, etc. In the light of clinical trials and evidential proofs, this has been concluded that UVB, especially narrow-band UVB, 311 nanometer irradiated energy segment, plays vital role in the treatment of vitiligo, psoriasis, and other similar conditions due to its specific characteristics of penetration up to epidermis skin layer. Therefore, there is no any significant side effects. Hence, this is highly recommended to adapt above said energy segment while treating the autoimmune related skin diseases. Unfortunately, if we analyze the electromagnetic spectrum of solar radiation, we will come to know that practically available useful irradiated energy of UVB is only 0.15%. Moreover, In addition to UVB energy, by default, we also get the exposure of undesirable energy, such as UVA and infrared, may cause the induction of potential side effects. Hence, it is apparent from the analyzed statistics that there may be relatively very slow recovery in treatment, as the scope of useful energy exposure is marginal, 0.15% only. Therefore, we need to explore more scientific devices and methodologies to get fast recovery and, moreover, without significant side effects from such chronic diseases like vitiligo, psoriasis and other similar skin conditions. To overcome the drawback of marginal availability of UVB energy 0.15%, Vision Tech Electronics presents narrow-band UVB 311 nanometer phototherapy device, which is meant to provide dedicated desired energy exposure of UVB 311 nanometers only. Due to dedicated design, we can get very fast recovery and, moreover, without any significant side effects in the treatment. In further section, we will go through diagnosis, parametric details, treatment protocols and many more with respect to this device. When dedicated irradiated, narrow-band UVB energy from the device is exposed over the skin having vitiligo, or more precisely, depigmented skin, this UV exposure promotes the melanosynthesis and stimulates the melanocytes. Those stimulated melanocytes start to produce melanin. In the same time, this exposure suppresses and deactivates the aggravated functioning of T cells. Eventually, repigmentation of the cells gets started. This kind of dedicated exposure gives the excellent, expedited results due to its specific penetrative characteristics. When there is successive and subsequent exposure of dedicated narrow-band UVB energy from the device over the psoriatic skin, T cells comes to steady state. Again, we can expect the excellent, expedited results due to its specific penetrative characteristics. We will go through the detailed highlights of narrow-band UVB phototherapy device. Aesthetic, general features, body, high-quality, medical-grade virgin ABS material. Weight, 450 gram. Dimensions, 450 mm by 60 mm by 48 mm. Ideal for home therapy. Treatment time, very short as compared to conventional methods. Body color, coral white. Excellent quality at minimum price. Easy and quick to clean. Packaging, very elegant and rugged. Helps device to keep safe and intact. Optical parameters, original Philips, narrow-band UVB, 311 nanometer, made in Poland, is used. Treatment area, 5 cm by 15 cm. Green indicator signifies healthy lamp. Blinking red indicator, along with buzzer signifies unhealthy lamp. High-quality curved mirror-light surface beneath the lamp focuses the narrow-band UVB light energy at optimum level. Electrical parameters, premium quality of industrial electronic ballast has been used, which ensures long lifespan of lamp. Main supply voltage, 230, 50 Hz. SPD, 6 kV. Power factor, 0.90. RFI, AMI suppression. Length of 3-pin mains cord, 6 to 8 feet. Lamp, PLS, 9 watt G23, color designation. NBUVB, on, off, rocker switch, is provided. Warranty, 1 year, except lamp, against any manufacturing defect. How to use narrow-band UVB device. Plug in 3-pin mains cord into 3-pin socket and then switch on the main switch. After this, switch on the rocker switch provided on device. For better results of the treatment, we should keep device as close as possible or touch against affected area of skin to be treated. We should use dark room for effective exposure of narrowband UVB from the phototherapy device over the affected area of skin, because undesirable ambient light may create unnecessary interference, eventually results in deteriorated performance and effectiveness of exposed UVB dose. Frequency of device. We should use the device on alternate day or 3 times a week. Before going ahead, we need to know one of the very important skin condition while treating with narrowband UVB phototherapy device, that is erythema. Exposed dose at which light pink skin color is perceived is known as erythema. This arrhythmic condition defines the compatible dose for patient, and that fixed compatible dose must be continued for the effective and result-oriented treatment. American dermatologist Thomas Fitzpatrick defined 6 types of skin color with respect to tolerance level of exposed UV, popularly known as Fitzpatrick scale. On the basis of those types of skins, dose protocols have been defined on the basis of innumerable clinical trials and evidences. We have classified and converted those dose protocols in the simplified format of minutes and seconds. We can see the simplified representation of dose protocols as given in table. For the sake of simple understanding purpose of the table chart, we will take one example of skin type 3, usually prevalent among Indian people. In this type of skin, initial dose to be adopted is 1 minute and 20 seconds. In next session, 20 seconds dose timing should be increased. In next subsequent sessions, go on increasing 20 seconds until arrhythmic condition is achieved. Suppose this condition is perceived at 3 minutes, then this dose should be fixed and continued. In other words, we can say that compatible dose exposure over affected skin area should be taken as 3 minutes. This continued dose will give the best results in the treatment. If face has to be exposed, maximum allowable limit is 7 minutes and 30 seconds. In case of other body parts, maximum allowable limit is 15 minutes. Similarly, other types of skin can be taken into the consideration as mentioned in table. If subsequent doses are missed, simply follow the suggested dose changes as given in the chart. Probable course of narrowband UVB: at least 18 to 36 sessions needed to assess treatment response. On an average, 48 sessions needed for slow responders. Maximum 72 sessions are needed. If results are not perceived, it is advisable to discontinue the course. To analyze the treatment efficacy, proper diagnosis and updates, this is highly recommended to evaluate the results with consultation of your medical professionals at least after every 3 months. After session of narrowband UVB exposure, this is advisable to avoid direct intense sun exposure, or you can go outside after application of broadband sunscreen having sun protection factor SPF 30. recommended emollients or topical oils before narrow-band UVB session in psoriatic skin. This is highly recommended to apply certain types emollients and topical oils over psoriatic skin before initializing the narrow-band UVB session with a view to enhance penetration of exposed irradiated energy, especially on body parts having psoriatic thick lesion. This kind of applied oils help to enhance efficacy of treatment and accelerate the clearance of psoriatic skin. We can use either of the following options of emollients or oils, such as mineral oil, Vaseline oil, olive oil, baby oil, glycerine oil, paraffin oil. We should avoid to apply coconut oil and sunflower oil, as practically those oils have not shown good efficacy in treatment. We should take care of special precaution with respect to certain sensitive body parts during exposure of narrow-band UVB phototherapy. If face or eyes are not intended for narrow-band UVB exposure, cover the face by any means and wear the UV protected goggles. Male genitalia must be shielded or covered by any means. Female areola must be shielded or covered, or sunscreen must be applied before session. If eyelids or nearby area is not intended for narrow-band UVB exposure, close the eyes firmly. During the course of the narrow-band UVB sessions, we should strictly follow the certain particulars. Take bath with mild soap or baby soap or cleanser. Limit to 1 shower a day. Consume lukewarm water for bath. Apply moisturizer after bath. Do not take immediate bath after session. Shorten shower time and do not take excess bath. Do not use hot water for bath. Sometimes, due to overdose exposure of narrow-band UVB or photosensitive skin becomes red. Some reddening of skin is normal. In this case, we can apply any suitable moisturizer over reddened area. Usually skin regains its normal state within 4 hours to 24 hours. In case of painful reddening, for better understanding and general guidelines, we can follow the algorithmic flow chart, or this is recommended to consult your concerned doctor. After recovery, this is not advisable to abandon the sessions of phototherapy on a sudden. Rather, gradually minimize the frequency of the days of the session. Take the dose twice a week for initial 4 weeks, and subsequently take the dose once a week for next 4 weeks. That means total number of doses will be 12 for the post-maintenance of treatment regime. We can visualize the details as per given chart. When in the treatment of vitiligo, psoriasis, and other similar skin conditions, in conjunction with phototherapy exposure, immunomodulators, or, in other words, immune system suppressors, are used, then that is known as combination therapy. The role of immunomodulator in the treatment is to suppress, control, or minimize the overactive or aggravated nature of T cells. Eventually, root cause of vitiligo and psoriasis can be eliminated. Tacrolimus is one of the safest topical ointment. Works as immunomodulator that can be applied over affected area of skin which gets absorbed, and overactive or aggravated nature of T cells can be suppressed. Tacrolimus does not contain any type of steroid. Therefore, this is considered as one of the safest topical ointment, which does not exhibit significant side effect. This can be applied on daily basis, up to 16 weeks continuously. This is advisable to apply on the night, because intense sun exposure should be avoided. At least 2 hours gap between narrow-band UVB phototherapy session and tacrolimus ointment application is recommended. For facial application, tacrolimus 0.03% and for other body part application, tacrolimus 0.1% should be used. Though there are so many other types of topical ointments which are available in the market and are being practiced, there is availability of other options also in combination therapy, such as steroid-based topical ointments, systemic medications, and biologics. In addition to, there are so many other alternative methodologies could be adopted with consultation of dermatologists and skin experts. Apart from successive clinical trials and evidences, it has been proven that intake of vitamin D3, 60,000 international units, once a week, gives 22% more faster recovery in the diseases caused by autoimmune-related disorders, such as vitiligo, psoriasis, eczema and other similar conditions. Vitamin D3, 60,000 international units, is available in the form of chewable tablets, gelatin capsules and sachet. We can choose any one out of these options. This video is for informative purpose only. This has not been made to enable anyone to undertake any kind of phototherapy treatment independently, rather highly recommended to get appropriate supervision by suitably qualified medical professionals. Guidelines, treatment plan is suggested plan only. Medical professionals are free to adapt, amend the contents at their own way. Neither the manufacturer nor the trial-based guidelines given in this video will not accept any responsibility or liability for any harm or side effects that may arise from the use of the device. Specifications can be changed without prior notification due to continuous research and development.